Now, I'm going to follow this all along. I just want to give you a quick introduction of something that I find really exciting as someone who's got a lot of kids with autism in my life, okay? 1 out of every 31 kids has autism spectrum disorder. How many FDA-approved therapies are there to treat the core symptoms? Here to help us understand why that may be about to change is pediatric oncologist Dr. Tom Megerian. He's the clinical director of the Thompson Autism and Neurodevelopmental Center in California and CMO of Cuomo Pharmaceuticals. Dr. Tom, thank you for joining me for this introduction to the audience. We got to do this in pieces because there's going to be a lot, and I want to follow your process. But help us understand, how can so many people, so many kids have autism, but there are not the therapies that we would expect?
Yeah, thanks, Chris. Thanks for having me on. I really appreciate the ability or opportunity to get the story out. Yeah, this is a hot topic, and we're grateful that it's a hot topic now. I think the key to remember is that autism is not one disorder, right? It's actually a conglomeration of 200 rare disorders or more. I'm giving you an off-the-shelf number, but it could be as high as 1,000. So that's very hard to treat. That's kind of like trying to treat the way we used to think about cancer, right? When I was growing up in the 70s, we talked about, I remember Richard Nixon talking about the magic bullet that was going to treat cancer. And of course, now we realize that cancer is a heterogeneous disorder. There's lung cancer, there's liver cancer, there's breast cancer, and even within those organ systems, there's different cancers. But I think, so people I think nowadays think, well, how are you going to come up with a treatment that's going to cure or treat, all of those various disorders? Well, we have a lot of examples of that, right? We have treatments for depression, which is also a disorder made up of many, many different etiologies. Right. We have anxiety disorders. We even have cancer. There are a lot of good drugs that work across multiple cancers. So we don't need to wait for us to understand. It's important for us to understand the molecular mechanisms, but we don't need to wait. We should be hitting this with multiple shots on goal, multiple clinical trials with multiple drugs, either off-the-shelf drugs or new ideas.
So you're raising money right now for a phase 3 study or trial. And you are super excited because you've never seen results like you saw on phase 2 with a drug called L179. It doesn't matter what it's called, but it's a brain chemical that helps make dopamine and norepinephrine. And you have seen results the likes of which you have never seen before. Just briefly tell people, what have you seen in phase 2 that makes you so excited for phase 3? We only have like a minute, so do it on the quick. And we'll do it again. We'll have more interviews.
Sure. Yeah, we saw improvements in the core social symptoms of children that we never saw before. I've been treating kids for 30 years. In 3 months, we saw kids improving their, quote, social IQ, one of the tests that we use, by 8 points. The social adaptive IQ by 8 points. That's like saying someone's, intelligence IQ moved by 8 points, where 100 is average, right? We saw kids that were below the 5th percentile moving up to above the 5th percentile. We saw kids who basically were only focused on their limited little worldview, their little perseverative stories that they couldn't get off of. Now, like, turn around and ask their big brother, hey, are you wearing new glasses? What's going on at college? Whereas before they would really just focus on their own, their own interests. And we saw kids actually starting to show affection.
I'm back with Dr. Tom Megerian, the Chief Medical Officer of Cuomo Pharmaceuticals, and they're moving on to phase 3. They're raising money for the trials right now with a treatment that could make a difference for kids with autism. What are you hoping for in phase 3? Just give me a quick maybe.
Yeah, we want to see the same results that we saw. What we saw was astounding. We just need to repeat it in a larger number of kids. We need to raise, about $75 million to do this. And honestly, it should be a no-brainer. We should be moving forward with our company and every other company that has a treatment that is promising. But we are, I think, one of the furthest along, and I'd really love to see us get that funding.
Dr. Tom, I'm going to follow your story all the way through at Cuomo Pharmaceuticals. Thank you so much for coming on. We'll speak soon.
I appreciate your time. Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.